Please take a look at the video. Observe the movement around the eyes when blinking and smiling. You might notice some slight skin laxity, but it is important to understand that this is actually the active movement of the orbicularis oculi muscle. By preserving this muscular movement, the natural volume of the agiosal hamtan, or the roll under the eye, is maintained. In the case of male patients, we often see a distinct protrusion caused by orbital fat. As you can see with this patient, excessive fat protrusion is a primary factor that makes one look significantly older than their actual age. It creates a tired and aged impression that cannot be solved by skincare alone. The most common approach in many clinics is simple fat removal. However, from a professional standpoint, we must be cold and objective. Simple excision is an outdated, lower-tier technique. While it may show immediate results, fat removal often leads to hollowed-out eyes in the long term, which actually accelerates the visible signs of aging. This is why many patients seek secondary revision surgery after realizing their eyes look sunken and tired a few years later. The key here is not to discard the fat, but to understand the anatomy. Between the protruding fat and the deep groove, there is a tough structure called the tear-trough ligament. This ligament acts like a tight tether, pulling the skin down toward the bone and creating a deep shadow. To achieve a fundamental solution, this ligament must be precisely released, and the existing fat must be relocated to fill the depression. Now look at the results. By performing relocation while preserving the tissue rather than discarding it, the protrusion disappears and the deep groove is smoothly filled. At ST, our global standard is to maximize your own biological material. We don't blame the material, your fat. We focus on utilizing it correctly. External fat injection is only a supplementary tool used to correct minor asymmetries. The core of the procedure is relocating the fat you already have to where it is needed most. Choosing a clinic should be based on who can design future volume. As we age, we naturally lose facial dimension. A clinic that simply cuts and removes is ignoring your face's future. Look at the details, whether from the front, the side, or when looking up, even when smiling. The transition is incredibly smooth and natural. This refined detail is the hallmark of ST's technical expertise.